You did everything right. The surgery, the chemotherapy, the radiotherapy, 5, maybe even 10 years of tamoxifen. You followed every step, but still, there's that voice. What if my breast cancer comes back? If you're watching this, I'm guessing you're feeling it too, because I feel it. At times you're scared and alone. Every new ache or pain just sends your mind racing. I know that voice. I've had breast cancer 3 times. I was a consultant breast surgeon when I had my first round of breast cancer back in 2015. And even though I was a breast cancer surgeon, someone who taught patients how to spot the signs, I knew the stats. Yet even today, I still lie awake at night wondering, what if it happens again? And if you've ever felt like that, this video is for you. I'm going to tell you why breast cancer can return even after full treatment. We'll talk about what recurrence really means and what it doesn't. I'm going to tell you what the signs and symptoms are, why it's not your fault if it comes back, but most importantly, what real hope looks like in 2025. But before we go any further, I want to say something loud and clear because you need to hear it. Most women with breast cancer are cured. And I don't think we say this enough. So let's look at the numbers. According to the American Cancer Society and CRUK, around 89% of women with early breast cancer are alive at 5 years and 80% are still alive at 10 years. And those stats are already out of date because it takes 2 or 3 years to collate and analyse and publish all the data from the trials. Most women with breast cancer will not die of it. But if you were diagnosed recently, this means that your chance of a cure is actually higher than you've been told, and it's getting better. New treatments are being added all the time, and I've just come back from ASCO in Chicago where there were so many new personalised treatments focusing in on molecular mutations and changes in your breast cancer. In the last 5 years, we've seen all of these. So for ER-positive breast cancers like mine, there are the CDK inhibitors like Verzenio. For HER2-positive breast cancers, there are targeted next-generation drugs like Enhertu. And for triple-negative breast cancer, we've got immunotherapy with drugs like Keytruda. There is more and more and more hope coming year on year on year. But even knowing that, the fear still lingers, doesn't it? Maybe your partner said to you, "You're cured now, we can finally move on with our lives." I know it's something my husband thought, and he's a surgeon, but he just didn't get what it's like to live with that fear, that worry. No one can tell you that you're cured. The only way to prove that you're cured is if you die of something else. And I think about my breast cancer coming back. It took me 5 years before I stopped waking up thinking, is this the day my breast cancer comes back? And I'm a consultant breast surgeon. This fear is real. But what actually is recurrence? And it's a terrifying word for doctors and patients. Any tiny niggle and your mind imagines the worst. Maybe like me last month, you woke up with a random ache in your hip and it didn't go away. And by 2 o'clock in the morning, I'd spent hours probing and feeling myself for lumps and bumps that weren't there the day before. Then I went downstairs so I didn't wake my husband up, and I got out my phone and I started Googling hip pain, breast cancer, Mets, how long have I got? By the time the dawn came, I was terrified. But then I remembered I'd gone for a run a couple of days earlier and I hadn't run for ages. And that was probably why my hip was sore. And I did some stretching and I took some painkillers and it went away. But that fear is real every time something happens. What are we going to do about it? My husband told me not to panic, that it's probably nothing. But that's because he can't bear to imagine the alternative. But it's the first thing that you and I will always think of, and for good reason, because we know there are men and women dying of breast cancer every single day. Now, in this video, I'm going to cover all the symptoms of a recurrence so you know what to keep an eye out for. But let's talk about what recurrence actually is when it comes to breast cancer, because there are 3 types and you might not have heard of them all. So the first one I'm going to talk about is called a regional recurrence. And that's when breast cancer comes back in your nearby lymph nodes, like in your armpit or above your collarbone or in your neck, or in the tissues on your chest wall. And this happened to me in 2018. It was 3 years after my first cancer diagnosis, and I developed like a thick wodge of scar tissue underneath my armpit. I'd had 3 operations there, I had a radiotherapy there, and I was getting physio every couple of weeks just to try and give me some movement in my arm. I'd had a really painful implant reconstruction and I was ready to go flat, and my surgeon said, let's just ultrasound this to be on the safe side. I didn't think it was anything. I'm a consultant breast surgeon. I have expert hands. In that scar tissue was a 2.5 centimetre local recurrence. And I was terrified. I thought if it's come back there so quickly, it's going to be everywhere. It's going to be in my liver and my lung and my bones. And I went home planning my funeral. Luckily, the CT scan that I had showed that it was just on my chest wall. And I had more surgery to remove it, and I had more radiotherapy, and the side effects for me meant I couldn't operate anymore. I couldn't get my arm up, and psychologically I was in a really screwed up place. My ovaries were removed so I could be put onto an aromatase inhibitor because I was still premenopausal, and I started the roller coaster again. It doesn't happen very often. It's about 1 to 3% of patients. So there aren't many people like me to talk to. And the incredible House Future Dreams in London has an online virtual support group for anyone who has a local breast cancer recurrence. And I seriously encourage you to go and check it out. The second type of recurrence is a local recurrence. This is when cancer returns in the same breast. If you've had a wide local excision, you get a cancer in the same space. It can come in the muscle on the chest wall. It can come in the scar tissue where your breast used to be if you've had a mastectomy. And this happened to me in June 2023. I was on holiday with my husband, cycling in the Dolomite Mountains in Italy, and I just got out of the shower and I looked down and I noticed a red spot on my scar. It was like a little small red ulcer, and there are pictures on my stories if you want to see it on Instagram and YouTube. And I knew it was a local recurrence. It was a classic spot. So I had to ring my GP in the car when I was driving back from Italy to get seen. It was about 1 centimetre in size, and I had the skin removed, and I'm now on treatment for life to stop me getting metastatic disease. So I get bum injections, fulvestrant every month, and I'm on a CDK inhibitor, and it's not great. But I'm a bit scared because I know, having had 2 local recurrences, am I more likely to get a proper recurrence? Because that's the one we're really all scared about. So what is a true distant recurrence? And that's the same as advanced breast cancer or late or stage 4 or secondary or metastatic. They all mean the same thing. This means that breast cancer cells have spread from the breast through your blood or lymphatic system to other parts of the body. Typically, it goes to the liver, the lungs, the bones, and for HER2 positive breast cancer, it can go to the brain. And this happens to about 1/3 of breast cancer patients in their lifetime. And I know that's a really scary fact to hear, but it doesn't mean that you have a 1 in 3 chance of getting advanced disease. It depends on lots of factors: your type of breast cancer, how young you were, how big it was, whether it was in the lymph nodes, lots and lots of things. And again, we are trying to reduce the risk of people getting that with all the new drugs we have. It's treatable, but we can't cure it. If you've only got a couple of deposits in your bones or in your lung or your liver, surgeons may try to remove those bits to reduce the tumour burden, and they will give you drugs to try and stop the cancers growing. But eventually, in the end, sometimes 10, 15 years later, the cancer wins. And I know that's horrible to hear. But at ASCO, the conference in Chicago I was at, there was talk of metastatic breast cancer for some tumour types becoming a chronic disease and being able to stop people dying. We really are that hopeful, all based on the new drugs, immunotherapy trials, vaccines are being developed. Every breast cancer patient has their own unique prognosis and treatment. It's not all the same. You cannot compare yourself to anyone else. But why does it happen? Why don't surgery and chemotherapy and radiotherapy cure people? Because if they don't, what's the point of having them? And I get this. I know if I hadn't have had surgery and chemotherapy and radiotherapy, I'd probably be dead by now. But let's talk about why recurrences actually happen. So there are 3 main reasons. So let's have a look. The first is that cells are left behind after surgery. And imagine you having the world's best party. Glitter and balloons and streamers of confetti. It's amazing. Morning after, groggy-headed, you vacuum, you clean, you wipe, you sweep, but months later you are still finding glitter in the carpet. That's like what happens. As a breast cancer surgeon, I remove all the breast cancer that I can see and feel. 9 times out of 10, I will mammogram it to make sure that I've got the cancer bang in the middle of the specimen. But there is always a chance that there are some cells left behind in the breast tissue, or a few cells had already escaped into the blood or lymph fluid. It's not your surgeon's fault. We don't leave breast cancer cells behind on purpose. It's simply because we can't see them. Cells are invisible to the naked eye. So a CT scan can pick up a cancerous deposit that's 2 to 3 millimetres in your liver, your lungs or your bones. But those 2 to 3 millimetres will contain 5 to 10,000 cells. That's why you hear the phrase, no evidence of disease. It doesn't mean there's no cancer there. It means there isn't a deposit big enough for us to see on a CT scan. We hope we never will see a scan, but cells are tiny. It's impossible to remove every single one, and it's impossible to see cancer cells in the blood. But because we know this can happen, we know that can be cells left behind. That's why we give radiotherapy to the breast and the lymph nodes. And because we know there may be cells in the blood or the lymph system, and that's more likely if you have breast cancer in your lymph nodes, we give you drugs like chemotherapy and targeted drugs to try and mop up all the glitter left behind. But sometimes there are still bits of glitter left that manage to avoid radiotherapy and chemotherapy. So how does that happen? Well, cancer is clever. It evolves in time, and it's not one disease. It's like thousands of mutated clones constantly rewriting their own rulebook. ER-positive cells can learn to grow without oxygen. They mutate so the receptors are continually switched on, so the cell is just being told to grow and grow and grow. Some cancer cells change their surface, like this lime that's hiding in a lemon, so the drugs don't recognise it. And other cancers develop mutations, like this orange that is now covered in thumbtacks, so the cell doesn't recognise it. They are clever and they can do this weeks, months or years later. It's not that the treatments we're giving you don't work, it's that the cancers find ways to avoid them. And that's why when one drug stops working, we give you another line of treatment to try and target this new mutation. The third reason that breast cancer can come back is that this glitter that's escaped, these cells, are just fast asleep. They lie dormant, like a hedgehog or a bear hibernating for years and years and years. And they can hide in places like your bone marrow. That's the stuff inside your long bones. They stop dividing. And when cells aren't dividing, it means chemotherapy and targeted drugs can't kill them because they need actively growing cells to work. And they avoid the immune system because they're just playing dead. And we can't control this. We don't know why it happens. And this is why breast cancer can come back 10, even 30 years in the future, because one day those cells just wake up. So what wakes them up? We don't know. Is it a hormonal shift? Is it inflammation or immune suppression? Maybe it's just random. But what I can promise you is this. It's not your fault. It's nothing you did. It's not because you were stressed. It's not because you didn't meditate enough or because you didn't skip sugar. It's just biology, and biology isn't fair. But if you're like me, after each of my recurrences, you might be thinking, was all that treatment worth it? Why did I put myself through the pain of chemotherapy and the instant menopause and the hormone blockers and the monthly treatments in hospital? Was it really worth it? Well, this is what the science says. So a 2018 study in the Journal of the National Cancer Institute looked at breast cancer patients who turned down conventional treatment and chose alternative medicine instead. The result, they were nearly 6 times more likely to die than the women like me who had evidence-based treatment. Now let me show you what that means. If you had standard treatment like me, your 10-year survival is 76%. So this is taking in every single type of stage and grade in breast cancer. We've lumped everyone together. It's out of 100 women, 10 years, 76 will be alive and 24 will be dead, the red dots. If you decide to go down the conventional therapy route, so juicing, Gerson therapy, Rife machines, whatever it is, you have a 65% chance of being dead in 10 years. 35 people are alive and 65 are dead in 100. Let's look at those two together. There is a huge difference in the number of women who are dead at 10 years because they didn't have conventional treatment. That's why we recommend you do what we suggest. We give you the best evidence, the best chance of a cure, and it's changing all the while. Again, as I've said, the drugs that target mutations, personalised treatments, liquid biopsies are around the corner. So yes, treatment is worth it. But how do you know if you've got a recurrence? This is what we really need to know. And I struggled as a doctor trying to work out when to tell a woman that a cancer might come back. Because you don't want to do it when you've just said, hey, the scar looks great, we've got it all out, off you go. Oh, by the way, did you know? But if I wait until the 1 year follow-up, it might be too late because breast cancer can come back quickly. And in fact, we don't know why, but it's most likely to come back in the first 1 to 2 years. And if you make it into 5 years, your chance of getting a recurrence is a lot less. But I want you to know what the signs and symptoms to look out for are. Now, they're all in my book, The Complete Guide to Breast Cancer. You can also find them online on websites like Breast Cancer Now and breastcancer.org. And I'm going to start with the symptoms of local and regional recurrence. So these are similar to the signs of early breast cancer. A lump, redness, rash, dimpling, your nipple being pulled in, a lump or a thickening in your armpit or above your collarbone or your neck, or a new red nodule or spot on your skin that isn't going away. You see that, you need to get it checked out. But the big one, what are the signs of distant recurrence? This is really, really important. The first is persistent bone pain. Now, that's a deep pain that you feel in your shoulder, in your hip bone, in your groin, maybe in your back. It's often worse at night. It doesn't go away with regular painkillers. Shortness of breath is another one when your breast cancer can go to the lungs, or a very dry cough. So not a phlegmy cough where we've all got those horrible chest infections in the winter, but a dry, irritating cough. And if that's lasted for more than a couple of weeks, you need to get it checked out. The third symptom is fatigue. And I know the cancer drugs make you tired. And I had no idea what cancer fatigue was like until I got it. You really cannot get off the sofa. But if you feel you are suddenly a lot more tired than normal and you haven't changed anything, that needs to get checked out. Unexplained weight loss is another sign that your cancer could have come back. If it's in the liver, you may have a bloated tummy. You may find that your skin has gone yellow or your eyes have gone yellow with jaundice. And sometimes breast cancer can go to the brain, especially with HER2 positive breast cancer. So you may get double vision or new headaches or lose your balance walking. If you've got lobular cancer, there are other signs because lobular is sneaky and it likes to wrap itself around organs. So you may get diarrhea, constipation, indigestion, heartburn, some gynecological problems. So please either go to my book or the website and make sure you know what the signs and symptoms are. How often should you check? Well, in the beginning, I think in my first 2 years after diagnosis, I would probe my body every other week, just in case I'd missed something. I was so scared of dying, and it paralyzes you. I don't think it's good to do that. I think it's really bad for your mental health. And what I would suggest, though, is every time you get a new symptom, make a note of it. Think, could this be something? So here's an example. I had a really painful head. I'd got a really tender bump on the top of my head, and I was convinced it was skull mets. I got a boggy spot. I was so paranoid, my oncologist arranged a CT scan of my head. The day before the CT scan, I remembered I banged my head on a low beam in the house. And that's why I had a bump. It was just a bruise from banging my head, but I'd forgotten. If you can't explain it, and it's been there for more than a week or so, and it's not getting better, then you need to ring your GP, your family practitioner, and tell them, and these are the magic words, I think my breast cancer has come back. I have shortness of breath, cough, hip pain. You need to say those magic words. I think my breast cancer has come back. Because your doctor may not know you. They may be a trainee. They may think, oh, it's just a cough, don't worry about it. You need them to know that you're worried. And hopefully they will then refer you on to the breast clinic to see someone like me, and I can then assess you and do the necessary tests to work it out. It's scary. I know, and I'm sorry if this has triggered you, if it's something you don't want to know, but because breast cancer can come back 10, 20, 30 years in the future, you do need to know what the signs are and you need to know what to do. But I've learned over the last 10 years that whether my breast cancer comes back again or it doesn't, it's actually out of my control. I can do all the drugs, take all the drugs even. I can exercise, I can cut back on alcohol, but it's still out of control. There's nothing I can do. I can spend my life worrying, or I can spend my time and energy on things that make me happy. Hope for the best, plan for the worst, and all good plans need chocolate. If this has helped you understand how breast cancer spreads, if it's given you clarity, if it's made you feel calm, if you're a bit braver, please let me know. And if you want to learn more about breast cancer, check out this video. I'm with you all the way.